Coordinating Minister of Health and Social Welfare, Mohammed Pate, has commissioned or inaugurated a newly upgraded National Polio Laboratory in Maiduguri, equipped with a genomic facility and solar power to strengthen disease surveillance and emergency response in the Northeast. Senior reporter Jessica Fida reports.
In Borno State, where disasters have often tested the limits of healthcare, one facility is rewriting its story, rising from damage to deliver hope. The National Polio Laboratory in Maiduguri once bore the scars of the devastating floods of September 2024. Critical equipment was lost, operation disrupted, and its vital role in disease monitoring weakened. But today, the lab stands renewed, stronger, smarter, and more resilient. The building now houses modern facilities, conference spaces, and research units. High-capacity solar power homes quietly in the background, ensuring uninterrupted operations, while flood-resistant structures guard against future setbacks. The federal government, working closely with the World Health Organization, says the upgraded lab will significantly boost Nigeria's ability to monitor and respond to polio and other infectious diseases.
Federal government is focused on building sound scientific practices, clinical research, clinical trials capability that is linked to the value chain that we can only industrialize if we're anchored around sound science and the capabilities in our universities.
Any investigation, any surveillance, we need the laboratory to confirm that this is the virus which we are dealing with. Hence the reason why we have to work on this agenda of improving the polio laboratory.
Beyond infrastructure, capacity is expanding. The laboratory has increased its workforce and enhanced its genomic sequencing capabilities, supporting surveillance for diseases such as measles, yellow fever, and rubella, while also strengthening training for medical and paramedical personnel.
To utilize this state-of-the-art facility and see whether it meets their needs, and then if there are reasons, opportunity to expand even further.
With this, we will be able to detect, test, and respond to infectious disease outbreaks rapidly and more effectively than before, whether it happens locally within Borno State or at the national level or international level.
Now described as the only integrated genomic sequencing facility in Nigeria's northeast, the lab is not just a center for diagnostics, it is fast becoming a hub for research, learning, and advanced medical innovation. Jessie Tafida, TVC News, Maiduguri.
And Jessie Tafida joins me on news from the state. Jessie, the National Polio Laboratory, Maiduguri, now includes genomic capability and solar power. Why does that combination make it especially important?
Well, it's very important, Ibrahim, because the University of Maiduguri Teaching Hospital has continued to provide healthcare services to over 1,500 people every day, because it's one of the largest hospitals in the Northeast region. It continues to provide this healthcare delivery. But, you know, the 2024 flooding came and the hospital was the worst hit. And now the federal government, together with the WHO, is coming together to, you know, provide all this equipment that was lost during the flooding. Now, it means one thing, that more patients now, you know, we will continue to access these laboratories, and more samples will be given. Talking about the solar-powered energy means that the staff can give out services 24/7 with an uninterrupted power supply. So it's a good news for the people of Borno State and the people of the region as a whole, Ibrahim.
So your report also notes this is the first genomic sequencing facility in the Northeast. How transformative is that for that region?
Yeah, just as I've said, it's good news for the people because the hospital continues to, you know, give out healthcare services to people not only in the region, but other neighboring countries come to this hospital, you know, for healthcare services. And with this new laboratory, you know, put in place, it means that more samples will be collected and more people will, you know, access healthcare delivery very easily, Ibrahim.
All right, so what about the people who attended this inauguration? Did they make any comments that shows how happy they are or how concerned they are, especially when it comes to maintenance of this facility?
Yes, as we've seen, the director of the the department is so much excited because she said that with this equipment now, her staff, with good working environment, her staff will continue to provide good services to the people. And just as you've heard, the coordinating Minister of Health says that the federal government is committed to improving the healthcare facilities across the country, to ensure that people are being given, easy access to healthcare facilities. And the WHO also are saying that they are always ready to collaborate together with the federal government to see how much they can boost the healthcare sector in the country.
Jessica Fida, thank you.